Good afternoon to you all. The topic for today's discussion is medical legal relevance of teeth. We'll cover our topics under following headings: the eruption of deciduous and permanent teeth, the morphology of individual teeth, age estimation from the teeth, a very important topic, and the dental charting after dental examination. Eruption of teeth. Except for lateral incisor. Pay attention, except for lateral incisor, dentition is earlier in the lower jaw. That means the eruption of lateral incisor, it is first in the upper jaw, then in the lower jaw, whereas all other teeth, they appear earlier in lower jaw. And it includes both temporary and the permanent teeth. The deciduous teeth, the number and eruption is more regular. That means they follow a specific sequence and their number, it is more regular in deciduous teeth. Eruption is not always bilaterally symmetrical. That means if we look at any particular teeth, it is not important that it should be present on other side also or on the other jaw also. For the same teeth, eruption is earlier in female by 1 year. The line says, if we say for canine teeth, the eruption of canine in females for permanent canine, it can be by the age of 10 years, whereas in males, it is by 11 years, then it is in females by 10 years. If we compare the specific teeth in both the genders, then the teeth are smaller in females as compared to males. The dental and skeletal age correspond more closely in males. That means that age estimation after dental and skeletal examination, they correspond more closely in males as compared to female, where the skeletal age is 1 year ahead of the dental age. And the anterior teeth, they are more suitable than the posterior teeth for age estimation. That means if we go from molar to incisor, the suitability increases, and if we go from incisor to molar, the suitability decreases. The temporary teeth, we'll discuss temporary teeth. Temporary teeth, as the slide says, they are 20 numbers. That means it includes 2 incisors, 1 canine, and 2 molars. 2 plus 1 plus 2 is equal to 5 multiplied by 4 means total they are 20 numbers. Incisors, the eruption of the temporary teeth, incisors, the lower central incisor, it appears at the age of 6 months. Then upper central incisor, 6 months, lower central, then upper central, 7 months, then upper lateral incisor at 8 months, then lower lateral incisor at 9 months. 6 to 7, 7 to 8, 8 to 9. Then after 9 months, next teeth is first molar. First molar appears at age of 12 months or 1 year. Next is canine by the age of 18 months, followed by second molar by 24 months. So the numbers which are imported here are 6, 9, 12, 18 and 24. By 6th is lower central incisor, by 9th lower lateral incisor, by 12th it is first molar, by 18th it is canine, and by 24th it is second molar. These numbers, they are important in the multiple of 3, 6, 9, 12, 18 and 24. Same here, the charting says the total number of teeth, temporary teeth in each jaw, they are 5. Central incisors, lateral incisors, canines, first molar, second molar. 5 in number multiplied by 4, making it total 20. And the sequence of appearance for the incisors, first incisor to appear is central lower incisor, 6 months, then 7 months central upper incisor, upper lateral incisor, followed by the lateral lower incisor at 9 months. For permanent teeth, They are total 32 in number. If we look at one side of the jaw here, if we are looking, there are 2 incisors, 1 canine, 2 premolars and 3 molars. This premolar, they were absent in temporary dentition, right? So 2 plus 3, 5, 6 and 2, 8. 8 into 4, making it 32. First permanent tooth to appear is molar by the age of 6 months. Then central incisor by the age of 7 years, followed by first lateral incisor 8 years, first permanent molar by 9 years, premolars. First permanent premolar by 9 years, second premolar by 10 years, then canine by 11 years, and second molar by 12 years, followed by last molar by the age of 17 years, 17 to 25 years. That means starting from 6th, 7th, 8th, 6th, 7th, 8th, just a sec. 6th, 7th, 8th, 9th, 10th, 11, 12, and then 17 to 25. 11 is important because this is canine appearing, and rest all from here the first molar, central incisor, lateral incisor, first premolar, second premolar, canine at 11, then second molar and last molar. The total number of permanent teeth from age. If we want to calculate the total number of permanent teeth from age, the formula is the age in years minus 5, the whole product, this thing is multiplied by 4. And this is applicable up to the age of 10 to 11 years, not beyond that, because up to the age of 10 to 11 years, it is mixed dentition. For example, if we want to find the number of permanent teeth in age group 8, that means from 8 minus 5 in bracket multiply by 4, 3 multiply 4, it means 12. 12 permanent teeth, they are there by the age of 12 permanent teeth by the age of 8 years, right? If we go back and check the permanent teeth, that means 2 molars in each jaw. Then this charting shows permanent dentition, first central incisor, lateral incisor, canine by the age of 11 years, then premolar, first, second premolar, first molar, second molar, third molar, canine here, then premolar, premolar. The gross morphology of the permanent teeth. The incisors. If we look at the crown of the incisors, they are the teeth in the front. The crown is chiasal shaped and they have single root. Look at the canines. The crown is conical and the root is single but larger and thicker than the incisors. If we compare the root of the incisors with the canine, it is thinner and it is thicker root. Looking at the premolars, they are also called as bicuspids. The crown is nearly circular and usually they have single root. And the molars, if we look at the molars, the crown is broad and upper molars they have 3 root and lower molars they have 2 root. That means except for molars, rest all have single root. So if we look at the diagram here, it has got 3 parts. The upper part is called the crown. The part between the soft tissue and the upper hard part is called the neck. And the lowermost part is called the root. Here, the bony part is there, where the tooth is attached. Now we discuss 2 important terms. First is superadded teeth. These are the teeth which have no deciduous predecessors. That means they didn't have any space. They erupt behind the temporary teeth. They erupt behind the temporary teeth, but not in the place of temporary teeth. And these are all permanent molars. These are all permanent molars which are superadded teeth. How many teeth we have? Superadded teeth? They are 6 in each jaw. That means 6 into 4, 24. Total 24 superadded teeth we have. And another term is successional teeth. That means they erupt in place of. Here they are behind, and here it is in place of deciduous teeth. Permanent premolars which were absent in the deciduous teeth, they appear in place of deciduous molars. They appear in place of deciduous molars. So permanent premolars, they are successional teeth, and they are 10 in each jaw. Then Gustafsson method. It's a method for estimation of age from dental examination or examination of the teeth. The age estimation by this method is done after the age of 21 years, where almost complete development of the or complete appearance of the teeth has taken. The factors which are considered under Gustafsson method, they are attrition of the teeth, periodontosis, secondary dentin, cementum apposition, root resorption, and the last is transparency of root. It is most important factor. And why it is more important factor? You answer this question in your comments, discussing each factor. The attrition. What is attrition? It is called the wear and tear of the tissue of the teeth due to mastication. It is called as attrition of the teeth. There is gradual damage to the occlusal surface, the upper surface of the teeth. There is gradual damage to the teeth by use of the teeth. It is wear and tear of the teeth called the attrition. And it goes to the starts from the enamel, goes to dentin, and then to the dental pulp. We'll see this thing into the diagram. Then periodontosis. It is the gums and periodontal tissue, they regress with time. As the time progresses, the gum and the periodontal tissue surrounding the neck of the individual tooth, they regress with time, leading to exposure of the neck and the adjacent roots. After exposure, there is loosening of the teeth followed by loss of the teeth. In individuals who maintain poor hygiene or who are on poor hygiene, their periodontosis is a frequent finding. Now, if we look here, the enamel, as a result of attrition, it is gone. Secondary dentin in place of dentin, and further, if we look down, the alveolar process or the periodontal membrane, the bony part is also gone here, exposing this soft area. Here we can see this area is exposed, whereas it is covered here in the neck. The attrition of the enamel dentin making the crown from the conical to the flat, and the secondary dentin. If you look at here, the secondary dentin is here. Secondary dentin. It develops from the wall within the pulp cavity, decreasing the size of the cavity. The cavity, dental pulp, the cavity here, it is very thin. Whereas if we look at, the cavity has increased. The cavity has increased here, and this thing, it has gone. It is reduced. It was thick here, but it is reduced here. Then cementum apposition. Cementum apposition means distribution of the cementum from its appearance here. It is distributed more and the layer has become thinner, leading to increase in the thickness due to change in tooth position with time. Secondary cementum. Cementum apposition leads to development of secondary cementum, which is gradual and slow process. Which is a gradual and slow process. It leads to the formation of incremental lines, which are cross striation on the enamel. Here, the cementum was there, it is absent here, and development of incremental lines in this area. It represents daily increment of the growth of the tissue. The thickness of the tissue is increasing here. If you look at this part and this part, it has become thicker. And it is mainly applicable. This cementum apposition examination is mainly applicable in age estimation in infants. Root resorption, if you look here, the root resorption, the bony part, it is almost completely absent on this side, and this alveolar process, it is no more existing here. It is no more existing here. Root resorption and the soft tissue, thickness of the gums, it has increased here. It involves both cementum and dentin. It starts from apex to down. From apex, it starts from here to this. Sorry, it starts from here to this place. The transparency of root is not seen until 30 years of the age. Transparency of root, last factor. And with time, the mineral deposition, with time there is mineral deposition, the root become translucent and the dentin become transparent. The root becomes translucent and the dentin become transparent. The dentin which was here, it becomes transparent and the roots become translucent. Transparency of root, as discussed earlier, I said earlier, it is most important criteria. Please comment in the answer. Please comment in your replies why it is most reliable criteria. Then we have Boyd's method for age estimation. It is used to estimate the age of dead infant. The cross striation develop in enamel till complete formation of enamel. And they represent daily incremental line. Starting from the neonatal line, they represent daily incremental line, and as counting of these lines can tell us about the age of the dead infant. Age is calculating in days. Count starts in lines from the neonatal line onwards. Last method is Steck's method. It is useful in infants. The age estimation is done by the height and weight measurement of the erupting tooth, and both deciduous and permanent teeth during erupting phase, they can be used for the age estimation by Steck's method. Now, another very important topic is dental charting. There are more than 150 methods for identifying, numbering and charting of the teeth used worldwide. Most common of these are universal system, Palmer's notation, header up system, FDI 2-digit system, modified FDI system, and the last is diagrammatic or anatomical charting, right? Starting with the universal system, it is also called as Cunningham system of dental charting. Here, the permanent teeth are calculated or counted from 1st to 32, starting from 1 to 32. And the deciduous teeth, they are represented by alphabets A to T. And how do we do it? It is in this way, from right upper to left upper 1 to 16, going down to 17 to 32. It starts from right upper to left upper, left lower, ending at right lower. Here, right lower, left lower. So, in universal or Cunningham system, we count the teeth from the upper, right upper to towards the center, moving to left upper, going left lower and right lower. And for temporary dentition, it starts in same manner from A to J, right to left, and then left to right. Right? Moving on to next system. This is Palmer's notation. The permanent teeth, they are 1 to 8, and deciduous teeth represented by A to E alphabets. That means starting from the center line. Here we start from the center. Earlier we were starting from the right towards the center, then going to left. But here we are starting from the center, moving to periphery. That means center to the right, center to the left, center to the left, then center to the right. Upper, lower, upper, lower. This sign here, this sign, it opens, it moves. This direction indicates the jaw, which is counting, which we are examining, and this lower arm, it indicates the direction which we are looking at. Here the horizontal line, it is pointing towards the end direction we are moving. This line is pointing towards the jaw, 1st to 8th. And for the deciduous teeth, same sign is used, but we are using alphabets here. Then header up system. It is method of 8 tooth quadrant system. Upper jaw we use plus sign, lower jaw we use minus sign. Right? A little bit confusing, but pay attention, we'll learn it. Right quadrant we use plus sign on the right side of the number. In left quadrant we use plus sign on left side of the number of tooth, the tooth which we are examining. Right? For example, if we write plus 1, that means we are going towards the right side. Or if we are writing 1 plus, 1 is indicating this, 1 is indicating the tooth, that is incisor, plus means upper jaw, position means on the left side. 1 is incisor, this is upper jaw, and this is on right side, that means right upper jaw, center teeth. If we go for the same tooth in the lower jaw, it is the sign placed, the number, the sign placed, and the number. Next is FDS system. Generally we are using this system now because it is least confusing. It is 2-digit system. We use 2 digits, and the first digit it indicates the quadrant, and the second digit it indicates the position of the tooth, individual tooth. This means in this way, 1, 2, 3, 4. Permanent teeth, they are 1, 2, 3, and 4. The quadrants indicating, and the second digit it indicates the tooth position. And the temporary teeth by same quadrant, but 5, 6, 7, 8. 5, 6, 7, and 8. 1, 2, 3, and 4, and the individual number of teeth. So this is, these are incisors, this is canine, these are premolars, and these are, all these 3 are molars, these 3 are molars on the second quadrant. The same number, second quadrant. Now third quadrant means left lower. And for temporary teeth, it is 5, 6, 7, and 8. And the number is same. 5th, 1st, 2nd, 3rd, 4th, 15th. Last is diagrammatic representation of the chart. The diagrammatic representation of chart is also called as the anatomical representation of the chart. It is pictorial symbols are used for each tooth. Same number of teeth, surfaces. It also includes surfaces of the teeth. Like for incisors, it has 4 surfaces. And for premolars and molars, it has got different surfaces, extra number of surface. That is, incisors, they have 4 surface, occlusal, that labial, and the lingual surface, and on the sides. And for premolars and molars, they have 5 surface, including the occlusal surface. The position of crowns, caries, fillings, etc., they are marked on the teeth. For other system where we have used the universal system or the FDA system, the tooth which is absent, we'll just cross it, or if it has not come up, we'll write absent. Whereas here we mark the individual teeth diagrammatically and the findings on the teeth. This was all from my side today. Please comment on the questions asked, share and like the content. Thank you.